I'd like to welcome you all here today for the Montgomery County Behavioral Health and Suicide Prevention Community Task Force Suicide Awareness Training. That is a mouthful. I'm Ken Schlenker. I'm the founder of CAREForce .us and the director of Chaplain programs here at Grace School of Theology, who's hosting us. We have a number of people that are registered, some that are here live in the classroom. Our seminary teaches in 38 countries in 8 different languages, completely online, fully accredited from undergrad through doctorate. So some of those individuals will be coming in here. And we're also concurrently streaming this on Facebook Live. So for our Facebook audience, welcome. I'm going to introduce, first, the agenda for today is from 9 till 10 o'clock. We're going to be doing Talk Saves Lives from the American Foundation for Suicide Prevention. We will then take a half an hour break, and then coming back from 10:30 till noon, we'll be doing Suicide Talk from LivingWorks.net, who is the premier suicide intervention skills training worldwide. Over 2 million people internationally have been trained and applied suicide intervention skills training as part of the suicide practice best practice registry. This morning, our presenter facilitator is going to be Judge Wayne Mack from Precinct 1, and I'll let the judge talk with you about who he is and what he does. So, Judge, thank you so much for being here.
Yeah, appreciate it. Good morning, everybody, and thank you for taking the time to be here today. And as Ken said, I'm Precinct 1 Justice of Peace, and here in Montgomery County. My offices are in Willis and Montgomery, Texas, and one of my duties as Justice of Peace is I'm also the coroner. And so I have been in office will be 6 years in May, and in that time I've done almost 1,600 death inquests, and the one thing that shocked me since I've been in office is the number of suicides that we have in our community. And so as I began to look at this, we realized that it was definitely an issue. And so the task force in our county, as well as working with the American Foundation for Suicide Prevention, is a mission of mine because we know that suicide can be prevented. And so this is a Talk Saves Lives presentation of the American Foundation for Suicide Prevention. So I do have some notes here because there are some topic things that I'm required to cover in this talk. And so we're going to go ahead and, Ken, are we ready to get started in that? So as we said, this is Talk Saves Lives, and we know suicide can be a very difficult subject to discuss, but it's critical in its prevention. And we're thankful for the American Foundation of Suicide Prevention for providing this information, because this is a great information. And what we do know about suicide is that talk does save lives. And so at any point during this presentation, we know this can be a very heavy topic. A lot of times people that are here for this information, they've been impacted. They may be a survivor. They may have a friend or a family member. So at any point, if this talk gets a little close or sensitive, feel free to step out, and we have people here that will talk with you about that. But we want to learn today about, in this presentation, and become more comfortable with how important this issue is. We know that suicide is a health issue. I go a little further in that, and that I believe that this is a public health epidemic. The CDC has just come out with the statistics from last year, and we know suicide has increased in our nation. In Montgomery County, pediatric suicides in 2019 doubled over the previous year. And so we know in the last 12 years in Montgomery County, death by suicide has doubled, but in the last 3 years, we've noticed an uptick in suicide attempts of tripled. And so we know this is a public health issue. It's very complex. Despite its complexity, we know that it can be prevented. And just like the warning signs and risk factors of any other health crisis, a cardiac arrest, we learn the warning signs and the factors that help prevent people from dying from cardiac arrest. And with other health issues, time can be a critical life-saving measure. And we're going to talk about those things today. And to prevent suicide, we need to identify persons who may be suicidal and take an active role in connecting them with this, because we know suicide can be prevented. I've had people, and I've given this talk several times in the last 6 years, I've literally talked in front of thousands of people, and I've raised this subject and this topic. And I've had people challenge me and say, well, not every suicide is preventable. And I disagree with that. I believe every suicide is preventable. Will we prevent every suicide? Well, history shows us that that's probably not possible, but we do know that every suicide can be prevented. So today in this talk, we're going to talk about the scope of the problem. The purpose of Talk Saves Lives is to provide community members with a general overview about suicide and who it affects and what we can do to prevent it. This presentation will cover some of the statistics. It'll give us the scope of the problem. We're going to look at research. The findings of research. We're going to look at what we can do with prevention as a community and what we can do. How we talk about suicide matters. Many teachings teach us that we have power of life and death in our tongue, and how we talk about suicide is very, very important. And we're going to talk about that very clear today. Things that we need to avoid is committed suicide. Nobody commits suicide. That's like committing diabetes or committing cancer or committing heart disease. It's death by suicide. They died by suicide. They ended his or her life. They killed themselves. No such thing as a failed or unsuccessful attempt. It's a suicide attempt, or it's death by suicide. And why is that so important? Because in our society, it's very, very important that we start building a conversation about mental illness and mental health and suicide and call it what it is and get to a place where we're comfortable to say it's okay, it's okay to say I'm not okay. And so words matter, and language, how we do this is very important when we talk about how we talk about this. Scope of the problem suicide is very significant. It affects individuals, families, and worldwide. Here's some of the scopes. We know of the countries that reported, almost 1 million people died last year by suicide. This number says 800,000, but I recently just saw a World Health Organization that pushed that number closer to 800 or closer to 1 million. So we know those are just the countries that report this. Of course, there's a lot of third world countries and stuff that don't, but we know 1 million people a year die by suicide. In the world, every 40 seconds, somebody dies by the suicide worldwide. In Texas, every 2 minutes. In the United States, it's the second. I don't know how to go back on this time. Let me say I went too far. There we go. In the U.S., it is the 10th leading cause of death. These numbers, the 2019 numbers have come out, and they are much higher than this, but it's still the 10th leading cause of death in the United States. Age groups, the age group between 10 and 35, it's the second leading cause of death. So between the ages of 10 and 35, more people die by suicide than die by illness or disease or cancer. And so that's startling. And as a society and as a community, it's very, very important we recognize this, because just like we have with diabetes and heart disease and all the things that we have done to the billions of dollars in research that we put into this, we look at right now the coronavirus that's going through. Less than 1,000 people from that have died. Thousands have been infected. But you look at the media that's put on that and the resources that are being thrown at that. The United States is sending planes to regions of China and bringing our citizens back. But yet this year, almost 49,000 people are going to die by suicide. We got to change how we look at this. And this is what I love about this talk. For every suicide, there's 25 attempts. And that's about 1 million people, 1 million Americans each year who survive a suicide attempt. Suicide impacts individuals. And when you think about the loss It impacts the people, the community. Suicide is no different. The loss that affects the families and coworkers and neighbors and schools and communities and places of worship. It has a huge impact on our community. There's also, they estimate a $69 billion economic impact in the United States. What I love about the American Foundation for Suicide Prevention is that they're leading in research. And we're going to look at some of the research and what research shows about suicide. Why do people take their own lives? Though there's no single cause, but rather multiple intersecting factors, one of the main questions that research explores is why this happens. And through the research, we've learned that there's no single cause, but often, like we said, many stressors, health issues that converge all at one time and cause this to happen. A large majority of people who die by suicide do have a mental health or mental illness condition contributing to their death. Research has consistently shown this, and the large majority of people who die by suicide have this. It may or may not have been diagnosed adequately or been adequately treated. We know that in a lifetime of an adult, 1 in 4 people will experience a health condition, but most don't go on to do suicide. Another figure that I've just recently been dealing with juveniles is that they estimate between 1 in 5 children, by the time they're 18 years old, will have a mental health event in their life. And so it's important as a community we have these conversations. We start teaching our teenagers mental health hygiene. We teach them how to brush their teeth and how to bathe regularly and so forth. But we need to also teach them mental health hygiene. How do you deal with failure? How do you deal with bullying? How do you deal with the stressors that life is going to throw at you? We do know that there are physical differences by people who do that by suicide, that die by suicide, and they die from other causes, both in the structure and function of the brain. We do know by the physical differences there are some of that. Also, addiction and so forth are all parts of these things. Most people who are suicidal, it's very on again, off again. They want to. The survivors that I have spoken to, they speak about how they didn't want to die, but they didn't want the pain to continue. And so they get to a point, those stressors, those things, but they feel like death is the only option. And so we know by many survivors. Kevin Hines, one of 2 people that jumped off the Golden Gate Bridge to take his life. We know he tells the story as going up to that point. As soon as his hands left the railing, he knew he didn't want to die, but he got to that point. The perspective of us, as we talk about this, the perspective of a suicidal person is that it's a crisis point that's been reached. They're desperate. They want to escape the pain. Their thinking becomes limited. You can imagine in your mind one of the most painful things you've ever experienced with a physical issue. For me personally, I've had 30 kidney stones. And just recently had an updated test, and the radiologist, I told her, my doctor, and my family, the next time I had a kidney stone, that I wanted to have a baby shower because they say it's like having a baby. The pain is. I've had 9 nurses tell me that they've had kidney stones and they've had babies, and the kidney stone pain was much worse. So I jokingly told this story to my radiologist last Monday and said, so next time we're going to have a baby shower. And she come out and said, congratulations, you're having triplets. Now that pain is excruciating, and I can promise you that when I've been in that pain, if you were to come up to me and start talking to me and asking me and saying, hey, can you give me directions to your house? I may have wanted to tell you where to go, but to my house may not have been one of those places. It's very, very, and so you have to imagine that pain, whatever terrible pain you've had, how distracting that is. Imagine somebody that is reached that crisis point that's so painful that they do not want, just the pain is so extraordinary that we have to understand that we need to learn how these feelings and how to deal with these feelings. And a lot of times these feelings are temporary, and the pain is temporary. And so we're going to talk a little bit later in the talk how we can deal with that. But it's very critical that we know that putting time and distance is very much a key. The research shows that it's very much a key. Putting time and distance between an event, whatever's caused that person to get to that point, is very, very, very important. Who's at risk? Research has helped determine the key factors and the increased risks. And so let's talk about some of the factors. But I want to just say this while I'm thinking about it, is that suicide is just like gravity. Suicide affects everybody. Mental illness, mental health, it affects everybody. And that's why I'm thankful for this talk that we're having today, because it does save lives. Here's some of the risk factors. We know that there's health and historical, environmental factors, and we've grouped in these categories, and so we're going to look at these categories in each section. So let's talk about the health factors. First type of risk factors include such biological and psychological medical conditions that the most significant are mental health conditions. And as we've said before, most people who die by suicide have an active mental health problem or at the time of their death. Depression is one of those, bipolar disorder, anxiety disorders, eating disorders, personality disorders, someone getting to the point of psychosis, post-traumatic stress, and substance abuse all can contribute to these. Many people may not realize that their distress has actually become a health problem, and by providing information such as a crisis number or mental health resources, someone who is struggling can help that person. And we'll talk more about this as we go in, and we'll directly address prevention, but these are the health factors that we know. Other health factors can be chronic pain and serious health conditions and head injuries, especially when these conditions exist and then you have a person who also has a mental health issue. These are all things that can lead to and push that person to that intersecting moment that we've talked about. Of course, there's historical factors of family history of suicide, family history of mental health conditions, childhood abuse, trauma, previous suicide attempts. One of the studies that I recently looked at, it showed that approximately 80% of the people that died by suicide have 2 to 5 attempts prior. There's that 20% of the population where everybody just didn't see it coming. But a lot of folks, they have those attempts, and it's an outcry. And Ken's going to talk about this later, but a lot of times people get to this point, it's an invitation for help. When they're talking about this, attempting this, that's an invitation for help. Environmental factors, access to lethal means, exposure, prolonged stress, stressful events in their life. There's aspects of a person's environment can contribute to the overall risk, but these are the most common, and having access to lethal means and so on and so forth. And knowing that as these stressful events again cross the lifespan, they include experiences like divorce and legal problems, job loss, and so forth, can all contribute to these environmental factors of this. What others see and what others may not know is to better understand suicide. Here's an example of the risk factors that can converge on a person. This example shows the public perception of suicide. And when someone dies by suicide, often the story only talks about the environmental factors, but people see life, and there's a breakup, there's bullying, there's job losses, and all these things happen. And we assume the person's killed themselves because of a stressful event, but we also know there's these other factors of genetic risk, prolonged stress, depression, drinking more than usual. These are all things the research shows. So you combine these factors and then life and these factors put together can cause suicide. The importance of research. We know there are biomarkers. We know there are psychotherapies as interventions and medications. We know, and when we look into the future, research can help us find the best ways to stop suicide. A number of clinical treatments and particular types of therapy that are effective more of those need to be developed. They need to be studied. And the good news is through research, we are learning more and more about those things that help. And research can also identify the most ineffective interventions in reducing suicide and risk of suicide and those suffering from mental health conditions. So let's talk about prevention now. The different types of protective factors with the focus on mental health and the importance of engaging in self-care, the need to provide support and for the lost survivors and those that have these lived experiences, and the critical prevention strategy and limiting access to lethal means is very, very important in prevention. These factors include mental health care and family and community support. Very, very important that just like any other risk factor, that we understand these and the idea that we can be proactive about mental health and make efforts to get healthier and protect ourselves. Feeling connected with family and community support can protect against suicide. When someone is struggling with depression, anxiety, or psychosis or substance abuse, these protective factors that may normally be strong can erode and temporarily weaken somebody. When that happens, having friends and having family, having their spiritual community with them, their cultural beliefs, problem solving, understanding, there's better ways to get through this problem than having to take their life, and encouraging and connecting people to seeking help and get a strong sense of purpose is very, very important when we think about these preventative measures that we can take. Mental health care, of course, you've heard us talk about this, is such an important ingredient to preventing suicide. It is so important, and we're going to focus on that topic for the next few minutes and getting effective mental health treatment for conditions like depression, anxiety, we know prevents suicide. We need to create a culture. We need a culture where everyone knows how to be smart about mental health. It's very critical in getting people connected with mental health treatment. One of the biggest challenges in fighting suicide is getting people to address their mental health in the same way they would their physical health. In fact, those suffering from mental health conditions are less than half will seek treatment. We've already identified that 1 in 4 people will have a mental health crisis in their life, but of those 4 people, only less than half are actually going to seek professional treatment. So we got a lot of people suffering in silence, and so we've got to, as a community, we need to understand that. As a community, we need to understand that there are people suffering in silence, and there's a stigma that goes along with asking for help. I tell a personal story where 11 years ago I was diagnosed with terminal cancer, and the family, my church, my work, my friends all rallied around me. And I think back to that moment, Kim, when I was telling them that news that I had this terminal diagnosis of cancer, how everybody just rallied around me. And then I think of the times as an adult, I battled depression just about my whole adult life because of some childhood trauma things that I had happen to me. And I think about the way the people rallied around me. If I'd have walked into that same room and said, hey, I'm bipolar, and people diagnosed with being bipolar, there's a higher mortality rate with someone that's diagnosed with being bipolar than somebody being diagnosed with cancer. And I wonder if I would have had that same rallying, that community support, if I would have said I was bipolar. And so it's very, very important as a community we understand prevention, that we create a culture where it's okay to say I'm not okay. That's what we've got to do. That's gonna be one of the biggest factors of giving people hope. Hope is the most powerful thing that we can give anybody, and we know that being for prevention, we've got to be able to do a better job than what we're doing with that. And being proactive, seeing a doctor, getting an evaluation, discussing treatment options, finding out what works best for the individual is very, very, very important. We need to look at this the same way we do our cardiac health and diabetes and you know, all the other things that we do. Law now requires that insurance plans cover mental health services. I do realize that there's not parity there. For example, my insurance that I have at my employer, if I was to have the flu or a cold, it would cost me $25 to go to a numerous number of professional providers. In fact, we even have a wellness center we can go to. It doesn't cost us anything to go to. But when it comes to mental health, it's a different thing. You have to go to, there's a process to go through, a very rigorous process. Many people just give up because they don't want the stigma that goes with getting to the point where they can get to the person that they really need help with. And then there's the cost for that is different. They only pay so much. And so we need some parity there. And so it's great that the law requires it's covered, but we need the same parity with mental health as we do somebody getting a cold or an ear infection. That's not my notes, by the way. Self-care strengthens mental health. We know this. It goes without saying. Exercise, sleep, healthy diet, stress management, those coping skills, mental health hygiene. These are all things that we need to emphasize. Self-care. We know why is it that we've had such an uptick in teen suicide, and I think a lot of it has to do with the supercomputer we call a phone, because our children have access to things that normally wouldn't have. Science shows that the same satisfaction they get from somebody liking or affirming them in social media it affects the same part of the brain center as drugs and alcohol do. So it can become very addicting, and so we know that understanding having the properness of this it's just as important as exercise and sleep and healthy diet. Teenagers should have 8 to 12 hours of sleep. That's what the science shows for children to be successful. 8 to 12 hours of sleep. Well, I can tell you that that's not happening. Many times we're allowing our children to take their social media and things to bed with them, and they stay up all hours of the night. The stresses of being on honor roll and involved in all these activities. And I hear the list of things that kids accomplish just to simply go to college, and they're not getting 8 to 12 hours of sleep. So we can't be surprised then when we start seeing these mental health issues come forward. Support for the loss of survivors. Very, very important that people that are touched by suicide have support, and because suicide profoundly impacts many, and it's important that the survivors have support and that they need, and both to heal and to reduce their own suicide risk. It's important thing that we can put between, and we know is putting time and distance is very, very important. For people who are at the crisis point, the most important thing we can do for a suicidal person is that in preventing them ending their life is giving them time. The research shows this, that it's only that by temporarily reducing the suicidal person's access to means, we know that giving that individual time will reduce and diminish the risk of suicide. And for a majority of people who have experienced suicidal crisis, if they're unable to access a method, even temporarily, then they're unlikely to engage in another action to end their lives. Because remember, we talk about them saying it was that moment, that time they wanted the pain to stop. And if you can put time and distance there, you can stop that. Of course, limiting access to means goes without saying, and we're going to talk about that One of the ways we can limit access is that the government would start requiring CO sensors in cars where when the CO reaches so much that it stops. Barriers on bridges, blistering packs for medication. My wife recently had the flu and I was getting her meds and it was in those blistering packs and I cut my finger multiple times trying to get those things open. But by doing that, what does that create for somebody?
Time.
It's a barrier.
It's a barrier, and it creates time, because a bottle of Tylenol is the most deadliest toxic drug that you can just buy off the shelf. And if you had to go through and individually take those out versus grabbing the whole bottle in that moment of pain, that would have an impact. And of course, without saying, securing firearms. Very, very important that we limit access to that when somebody's in crisis. So what can we do? We've talked about all these things, prevention and limiting access and all these things. So what can we do? What can we do as a society? Let's talk about it. Well, the first thing we can do is like we're doing today is have a conversation. It's important to have a caring, supportive conversation with someone you might be worried about and allow them to share what they're experiencing. The conversation is a way to show that you care and allows you to get more information about their level of stress. And we're going to kind of break that down a little bit here today. We're going to talk about some warning signs. We're going to talk about reaching out and also seeking help. Like many risk factors, as we've discussed, that endure over a longer period of time, warning signs observable and signals and suicidal risk. By knowing those, we can assess those, and it's important that we pay attention to both the risk factors we discussed earlier and the warning signs we're talking about now. And if we see warning signs, we reach out to that individual that we're concerned about, and we reach out to others that are struggling, and we seek mental health services. And we create a culture of this, that it's okay to say you're not okay. And if you're depressed or you have an anxiety and it interferes with what you're doing daily, we can encourage people to do something and take action. So here, let's individually just kind of break down some of the basic warning signs. And for the class here today, the second part of this, Ken is going to go into some really good detail about some of these things. This is kind of general. But when somebody starts talking, we know that these signs, these are the three main signs that we know: talk, behavior, and mood. And we'll discuss each one of those in detail. Many people who are suicidal talk about ending their lives. This may be directly or indirectly. A person can say outright, or they may joke about it, but take it seriously. Some people say they have no reason to live. That's a sign. I can't take it anymore. I have no reason to live. Others say things that they feel trapped, or that they feel like they're a burden, or they might talk about feeling overwhelmed and the unbearable pain. These are very important that we understand that when people start saying things, it's just like when my wife started running 102 fever. We knew something was wrong. And so it is with when people start talking about this, we know that something's not right. And many times that's an invitation. Without saying I need help, they're saying I need help. When your body starts running 102 temperature, that's your body's way of saying, hey, something's not right here. Behavior. We know with an increased use of alcohol and issues with sleep, we know that these are all things that are signs and warning signs that something's not right. We know this. And we know that when they start acting recklessly or withdrawing from activities or isolating themselves from friends and family. I personally have some family members that have extreme mental illness, and I know when I stop hearing from them regularly that I know something's not right because we talk regularly. And so sometimes when they start isolating themselves, it's because they don't want to pretend it's okay. They don't want to pretend like life is good. They don't want to, how you doing today? They don't want to lie to me and say, And so by them not talking to me, I know that there's something there. And when they start isolating themselves, you have a coworker that all of a sudden they start not coming to work regularly, or if you're a student, you have a fellow student that stops caring about their grades, start withdrawing themselves from activities that normally. These are all warning signs. Looking for a way to kill themselves and giving away their possessions. If you have a friend that's never owned a gun and they know you have guns and they start, hey, can I borrow a gun? There needs to be a good reason for that, and not just out of the blue. That's just not something. It's not a normal thing. Of course, mood, depression, apathy, rage, irritability, impulsiveness, anxiety. These are all things people at risk for suicide can display. Often many of the same things at the same time, and we know that we all have our ups and downs in our mood, but when you notice change and that seems uncharacteristic or concerning, it's important that you speak to this person about what you're noticing. For example, a sudden unexplained happiness can indicate an individual may have a plan, and they're all of a sudden relieved because now I have a plan. So these are all things. Trust your gut. Assume you're the only person that is going to reach out to this person. It may be that God has put you right there at the right time. Go with your gut. Don't say, well, I don't want it. I don't want to embarrass them, or I don't want to make them feel bad, or I don't want to overreact. Always trust your gut. There's when a lot of things, these things we talk about, and the changes in behavior, trust your instincts, assume you're the only one. And then here's a rule of thumb. If you're wondering if someone is depressed or overwhelmingly anxious, and that's a sure sign that you should reach out. Same goes for you. If you're having suicidal thoughts, if there's a sign you need to seek help, that is a sign for you personally. Again, the mental health hygiene we're talking about. If you have reached out before, reach out again. The first time the person may not be receptive, but you keep trying to talk to someone, and also trying to talk to someone else, or getting them to a professional is very important. And even if suicide turns out not to be the concern, they still may be in distress, and they may feel comfortable and supported by just knowing that you care about them. Because hope is one of the most powerful things in the world. We've all had times in our life when someone's given us hope, and think about how relieved you were about that. How to reach out. Talk to them in private. Listen to their story. And ask directly. Don't beat around the bush with this. You ask directly, are you thinking of suicide? Are you thinking of ending your life? Be direct with it. Put light on it. Don't let that darkness can without, what is the definition of darkness? The absence of light. We shut the lights off in this room, it gets dark automatically. And a lot of times when people start shutting you out of your life and they start making these decisions, these behaviors, what are they doing? They're going dark. And so what you need to do is put light on it. And you need to ask them, are you thinking of ending your life? Are you thinking of killing yourself? Are you thinking of suicide? Be direct with that and put light on that. And encourage them to seek mental health. Avoid minimizing their feelings. Those who have never experienced major depression literally can't imagine what it feels or what it looks like. So don't try to minimize, and avoid trying to convince them that life is worth living. If a person is near a crisis point and they're not thinking clearly, philosophical debates about life and what it's worth this is not the appropriate time. If I was to grab my chest and hit the floor and I'm going into cardiac arrest, is not the time to start talking to me about how much fried chicken I've eaten this week. Okay? And so it is with this. This is not a time to try to fix it. It's not a time to start talking about have you exercised regularly and this and that. Avoid those things. And if they're in crisis, that what they need is to be heard, and then they need you to lend help. And listen to their story, offer them help, find a health professional, and help them take active steps toward keeping their environment safe. If you think a person may make an attempt soon, you stay with them. If you think they're planning on dying by suicide, you stay with them, and you don't leave them alone. However, the situation is where your own safety is at risk. It's kind of like, what do they tell you on the airplane? In the event that this cabin becomes depressurized and the mask falls down, what do they say? Put your own mask on first, and then help the other people around you. Okay? And so sometimes it may be in a situation where it's very unsafe, you may need to do the things that you need to do to take care of yourself and then come back to them. But if at all possible, stay with them, remove lethal means, or remove themselves from potentially dangerous area, and escort them to emergency health services and emergency room. This next slide we're going to show you, very, very important. Generally when I give this talk, I tell people to take out your cell phone, take a picture of this, put this in your phone. But you have a brochure that we're going to give you. Those online, if you're online watching this, feel free to get this information. This is a 24-hour professionally manned, trained counselors to help you and that person in distress. And if they don't feel comfortable talking to you, maybe a counselor on the phone. They can also text. As we know, those of us that have teenagers and children, they actually think when they text somebody, they're actually talking to them. And so very important to get this number in your phone. We also know that the FCC has now approved the legislation that was introduced, that 988 is now going to become a number that you can dial just like you call 911. I don't know what the timeline on that is. I know it has to go through a procedure, but then the 911 centers are going to have to get the programming and all that stuff. So it's down the road, but at least we're moving in the right direction. It's because it's something that's been hung up for many, many years, and I'm glad that the current administration is making that happen, because that's going to be very, very important. And of course, for all emergencies beyond that point, call 911. I've actually recently was in a situation with somebody that was in crisis, and I actually called the number, the earlier number that we put up on the screen there, and actually just put it on speaker and got the professional counselor on the line and started talking. And that's something you can do while you're staying with the person. Say, hey, this is not really, I really think we need to talk to somebody professionally, and get them on the line, and they're going to answer. And it's a great resource. We need to create a culture, as we've said earlier, that's smart about mental health and suicide prevention. And together, by creating this culture, we can save lives. We can vastly improve the lives of many, many more. And again, I'm thankful to the American Foundation for Suicide Prevention for this talk. I've given this talk to hundreds of people, and it's very impactful, and it starts a conversation. We're recognizing in our region that people are getting more active. Our task force. We have 14 working work group, a couple hundred volunteers, and we're looking at all the resources and all the things in our community. And so by talking about this, we can and we know that talk saves lives. We thank you for your being here today. Those watching online, we're thankful for you that are watching, and we certainly know that talk does save lives. So God bless you and thank you for your time today.
Well, I'd like to ask if you have a little bit more time, Judge.
Yeah.
If anybody has any questions about this. And for those of you that registered and are on the Blue Jeans session, please feel free to also pipe up. And for those of you on Facebook, we will be replying back to your questions and comments. So any questions for anybody?
Yes, ma'am.
Kind of a physiological question. So you mentioned that they found that the differences in the brain when for people who have taken their lives.
Yeah.
What are those? What do you know what those differences are?
So what we know is that the propensity for suicidal ideation, that there is some, they have with the research have noticed that there is some developmental parts of the brain, and I'm not a doctor, but we just know the research shows that that is a contributing factor. It's not the contributing factor, but it is through the research, and that's what's so important with the American Foundation for Suicide Prevention is doing, because they're leading that, and we know with the more studying that we do that we can maybe identify. So in identifying that, then preventively, doctors can start to know, hey, this person just simply by their
His action.
yeah, they know that there's an ideation there, and so that to help prevent it. Yeah, very, very important. Great question. I wish I could medically break it down for you, but unfortunately, I'm Judge Wayne Mack and not Dr. Wayne Mack.
No, that's fine.
Yeah. Yes, ma'am.
This is a wonderful orientation for those of us in the community. How far have we come in presenting this information to teens?
So what we're working. That's a work in progress.
Okay.
The legislature has now started mandating that schools, as a part of their health curriculum,
Okay.
start having this conversation.
Wonderful.
We're moving in the right direction.
Okay.
I can tell you that we are far better off than we were just 5 years ago.
Yeah, 'cause nobody talked about it.
Yeah.
Yeah.
And it's one of those things.
Yeah.
Even the media
Yeah.
has gotten more open to talking about it. A lot of times, for example, when Robin Williams took his life, then everybody was talking about suicide. But literally, like we said, every 2 minutes in Texas. So we've been in here 49 minutes. 20 people have taken their lives in
Right.
Texas.
This most recent case where the little girl went to prison, I believe, for encouraging her boyfriend to, what they said, she encouraged her boyfriend to
they
commit
charged her.
suicide, may be the beginning of
A conversation.
really open conversation for teens.
Yeah.
And
Yeah.
bullying is connected with, I don't know what this situation is, but I do know
Yeah.
that's what the outcome was. And
Here in Montgomery County, we have the highest teen suicide rate in the state of Texas.
great.
CAREForce works, and so does Judge Mack, and a host of 150 different other organizations here in the county as part of the Behavioral Health and Suicide Prevention Task Force, coming together with our first responder community, our veterans, the education, healthcare, and the faith community to remove the stigma that surrounds mental health and suicide.
Good.
One of those organizations is Cassidy Joined for Hope, Kim Hess.
Yeah,
And
that's what
Kim's daughter Cassidy died by hanging at age 16.
right.
The foundation has started student-led clubs in the school that are basically peers looking out for one another. CareForce, I'm on the board for Cassidy. We've gone in and we've trained about 75 15-year-olds on what's called Safe Talk. I'm going to talk a little bit more about that this afternoon or in the next talk. Safe Talk is you identify somebody who has thoughts of suicide. How do you talk to them and get them to somebody who can do an intervention? Okay. Recently, we trained 100 faculty on ASSIST, which is Applied Suicide Intervention Skills Training.
Okay.
And over 2 million people internationally have been trained in this. It's actually what they do on the suicide hotline. CAREForce is in collaboration with the Harris Center in Houston. That is where the suicide hotline is. So the co-facilitator that taught with me, Carol Prasad, is over the community outreach, and by Keisha McKinney and Amy Tompkins and all of them, and Jennifer Battle, who actually oversees the hotline. We're all affiliated with that. So there's a major push here in the county to get into those 5 domains, but really with regard to our youth, we're really making an all-out effort to get that into the schools.
It's important that we pull this veil down.
Yes.
Like I said earlier, putting light on the darkness, and as a community, what you can do is American Foundation for Suicide Prevention will come to your place of employment, your place of worship, your community organization, and give this talk. Mm-hmm. This is a great conversation starter. And so very, very important as a community that it doesn't just stop here with what you've learned here today. You need to share this with somebody. And we need more facilitators to teach this. And very, very important that we as a community start having those conversations, like Ken has talked with and with the young people. But we would like to see that every school district have that peer-on-peer mentorship part of this, and that's what we're working on.
Excellent.
And we have great collaboration. The task force has every school district represented in our task force, and that's never happened before. We got everybody in the same room last May. We had 460 people show up for this, over 100 different agencies that showed up in this. So we're doing our part. We're light years from where we were just last year, but we're moving in the right direction.
Right. Watch the stats if they'll start to go down.
Yeah, we'll talk about that a lot.
That's excellent.
We're going to go. We were going to start until at 10:30, but let's just take a 10-minute break. And for those of you that are online or maybe just joining us, come back in about 10 minutes, and we're going to start with a suicide talk from the LivingWorks education out in Toronto, Canada. So hang in there. We'll be back shortly. Judge, thank you so much for your time.
Thank you for being such a bright light.
Absolutely. And just one last thing. Part of the reason we're doing this is a live taping. Our intention is we're going to end up with 2 different videos, one of Talk Saves Lives and one of Suicide Talk. We're going to edit it afterwards, and then our intention, especially here in Montgomery County, these are going out to those 150 agencies that we talked about in our collaboration, so that they can utilize these 2 videos any way they see fit within their agencies, so we can disseminate this awareness information with the hope of afterwards having more full-on training, so people are not going to dismiss, or avoid the issue of suicide, but they're going to be suicide alert first aiders, and that's what our goal is. So thank you for attending. If you are on Facebook, please consider bringing us to you, and we'll do more of these as we move forward. So let's come back in about 10 minutes for your break.